MERSCOV and COVID-19 are respiratory diseases that are being transmitted to respiratory droplets. It is caused by a coronavirus. Coronavirus is a virus that has a crown feature resembling a crown. That's why it's got its name as corona. Okay? It is a virus that can cause as a simple disease like common cold to a more deadly disease like the MERSCOV and SARS and what we have now, which is the COVID-19. COVID-19 came from China and the source is unknown. However, when we talk about MERSCOV, it originated from Saudi Arabia and they're telling that the source is the dromedary camel. Be it MERSCOV and COVID-19, we have what we call the case definition. Case definitions are made in order to help the healthcare workers in identifying patients who are potentially having COVID-19 and MERSCOV. So let's start. Let's start with MERSCOV case. The MERSCOV is short for Middle East Respiratory Syndrome Coronavirus. And when we talk about the case definition, we have two types of cases, suspected case and confirmed case. Let's start with suspected case. Under the suspected case, we have 4 clinical presentations, and we will go them one by one. Let's start with clinical presentation number 1. If you receive patient having severe pneumonia, with severity score of greater than or equal to 3 points, or having acute respiratory distress syndrome, with clinical or radiological evidence, automatically you're going to suspect them for having MERSCOV. No need for additional criteria. Second, clinical presentation. If you receive patients who are suffering from unexplained deterioration and are having chronic conditions like congestive heart failure and chronic kidney disease under hemodialysis who suddenly deteriorate, automatically you're going to suspect them for having MERSCOV. No need for additional criteria. Why? Because these types of patients are considered as immunocompromised and they can catch infection very fast. The first 2 clinical presentations that I discussed to you doesn't need any additional criteria in order for you to suspect them. Automatically, you're going to suspect this patient for MERSCOV. The second 2 that I'm going to discuss now will need additional criteria in order for you to suspect them for having MERSCOV. What are those patients? Okay, let's go again. Clinical presentation number 3. If you receive patients having acute febrile illness with or without respiratory illness, or clinical presentation number 4, if you receive a patient having gastric symptoms like nausea, vomiting, and diarrhea, and when you check the CBC report, you're showing here that the patient is leukopenic, the WBC is less than 3.5, or the platelet is thrombocytopenic, it is less than 150, before you suspect these patients, they need to meet a criteria first. They should have an exposure within 14 days to one of the following. They have a direct contact to a positive MERSCOV patient. Second, they visited a healthcare facility with a positive confirmed MERSCOV patient. Or they have a direct contact to a dromedary camel or consume camel products like uncooked camel meat and unpasteurized camel milk. So those are the suspected cases under MERSCOV. Now let's go to the confirmed case. What is confirmed case? These are suspected MERSCOV patients that have laboratory confirmed MERSCOV result, meaning MERSCOV positive. COVID-19 is short for Coronavirus Disease 2019. And same like MERSCOV, it has a case definition. Under the case definition of COVID-19, we have 2 types of cases, suspected case and confirmed case. Let's start with suspected cases first. Under the suspected case, we have 3 clinical presentations. Let's start with clinical presentation number 1. Who are the patients we're going to suspect for COVID? If we have patients who are coming in the hospital who have acute respiratory illness with sudden onset of cough, shortness of breath, and fever, automatically you're going to suspect them for having COVID-19. No need for further or additional criteria. Second clinical presentation. If you receive patients who have headache, runny nose, sore throat, diarrhea, and nausea, before you suspect these patients, they should meet a criteria first. they should have an exposure within 14 days to the following. Either they have a direct contact to a positive case of COVID-19, or they're working or living in a place where there's outbreak of COVID-19. Okay, let's differentiate clinical presentation number 1 and clinical presentation number 2. Let's put it in a scenario. Okay, if you receive a patient having sudden onset of cough, shortness of breath, and fever, automatically you're going to suspect them for having COVID-19. However, if you receive patient having headache, runny nose, sore throat, nausea, and diarrhea, before you're going to suspect them for having COVID-19, they should have met a criteria first, an exposure within 14 days to one of the following. Either they are exposed to a positive case of COVID-19, or they're working or living in a place where there's outbreak of COVID-19. Okay, and last, clinical presentation number 3. These are for admitted adult patients who are suffering from severe acute respiratory illness that has unknown cause, either community-acquired or hospital-acquired. Meaning to say, if we have a patient admitted in hospital who have SARI, severe acute respiratory illness with unknown cause, not TB, not H1N1, not MERSCOV, automatically you're going to suspect them for having COVID-19. So those are the suspected cases under COVID-19. What are confirmed cases? Confirmed cases are suspected COVID-19 cases that have laboratory confirmed positive COVID-19 result. So how are you going to handle a MERSCOV or COVID-19 patient? When we talk about this type of diseases, we have two types of patient, stable and critical. By nature, COVID-19 and MERSCOV are droplet. That's why whenever you're handling stable COVID or MERSCOV patient, you need to observe droplet precaution. What are the PPEs that you're going to wear? All your PPE you need to wear: gloves, mask, face shield and goggles, and gloves. Okay, what kind of mask? Normal procedure mask. Okay, please take note that as long as that the stable patient has no aerosol generating procedure, meaning to say you're not going to perform nebulization, suctioning, CPR, CPT. Okay? Because if you're going to perform aerosol generating procedure, it's a different scenario. You need to observe now airborne precaution. Okay. If you're observing a stable or you're handling a stable patient, you're going to observe only droplet, and a normal single room is enough for the patient. No need for negative pressure room. However, if you're handling a critical patient, okay, you need to perform or observe airborne precaution because you're anticipating that you're going to do aerosol generating procedure to the patient, like suctioning, CPR, CPT, and simple as intubation. And there's a need for the patient to be placed in a negative pressure room, or if it's not available, it's okay to put the patient in a single room with a portable HEPA filter. So there you go. I hope you learned something about our short discussion regarding the case definition of MERSCOV and COVID-19. And I hope that you're going to apply it in your everyday duty. Thank you for watching and see you on my next video.